Hi, Tony Willis here, the Clinical Director for Diabetes North West London, talking a little bit about the criteria and protocols around the Rewind programme. So from the clinical system on the clinical template you can easily access the protocols for patients involved. I'd recommend setting your default browser to Chrome as it's much more likely to open up nicely. So we'll view the protocol from the clinical template here, and it will bring up the clinical protocol and pathways and medication requirements and so on. So there's just a short bit of information about the simplified pathway. The key is that the patients are invited generally through text messaging or face-to-face. What we'd recommend is initially bulk text messaging all of your potentially eligible patients, and then following up in one-to-one as they come in over the course of the year. Patient is referred into the UK ICS team and they will agree the pathway that the patient follows, whether it's total diet replacement or low carb, confirm the diet start date, and then UK ICS will email the practice with information about the patient and which pathway they're going to follow and the diet start date. It's important that at that point that the patient is contacted and some reviews are arranged. You'll want to code the information on the clinical template. It's all there ready for coding, and then arrange follow-ups at 1, 2, 4 and 8 weeks. These can be done by telephone. In fact, most of the interchanges with the patient can be done by phone rather than seeing the patient face to face, which will save some time. There's an additional follow-up at 12 months. So just moving on, we'll talk a little bit about the inclusion-exclusion criteria. So it's important that the patient is registered with your GP practice or one of the other GP practices in North West London. They're aged over 18, they've had diabetes less than 12 years. Initially in phase 1 we may extend these criteria outwards once we've been able to do some evaluation, and crucially that they're on a DPP-4, an SGLT2 or a GLP-1. At the moment, if their HbA1c is over 85, they're excluded unless they were diagnosed within 6 months. Again, with some further evaluation, we may extend these criteria out to higher levels of HbA1c. They can't at the moment be on insulin, pregnancy, or have severe renal impairment, and they need to be able to follow the program. There are some further specific criteria for total diet replacement. If they are not of South Asian or Chinese origin, their BMI needs to be above 27. They can't have active cancer other than local skin cancer, have had a heart attack or a stroke in the last 6 months, have severe heart failure or active liver disease other than non-alcohol fatty liver disease. They can't be substance users or have an active eating disorder, porphyria, untreated proliferative retinopathy, or currently treated with anti-obesity drugs, but they could stop those if they're on them at the moment. Additionally, they can't have a recent weight loss of over 5% body weight that is unexplained, be on a current weight management program, or awaiting bariatric surgery, in which case they would need to come off that waiting list. Important that SGLT2 inhibitors are stopped as part of this. So we'll go on to we'll miss out this section and we'll come on to the key component of the program, which is stopping medication prescriptions. So it's important to understand that this is evidence-based. We're basing this on the criteria and the protocols that we use for the direct program. This was the diabetes remission clinical trial that was done up in Newcastle, and a number of pilots that have since then been done around the country. So this is very much evidence-based. The protocol was created in conjunction with an expert advisory group gathered together by NHS England. The recommendation is that patients on total diet replacement stop all of their diabetes medication other than metformin on day 1 of the program. We know that there's a rapid weight reduction on total diet replacement and a rapid reduction in glucose levels. Very important that patients stop all medication, all hypoglycemic medication other than metformin on day 1. If blood pressure is above 140/80 at the baseline, they can continue all their current antihypertensive medication, but if their blood pressure is currently well controlled, then they should stop one of their antihypertensive medications, and there's a specific order for this. Alpha blockers as the first one to stop, followed by beta blockers, followed by amiloride or spironolactone, and obviously there are some caveats around concurrent use for heart failure, then followed by thiazides or calcium channel blockers, and lastly stopping ACE inhibitors or ARBs. Again, caveat around reducing dose if the patient has heart failure, previous MI or raised ACR. They should continue with lipid medications, and then there are some criteria for stopping or continuing medications if dependent on what their blood pressure is at intervening medication review times. Again, as I said, these can be done by telephone with the patient. The protocol for the low carb diet is slightly different. It's a slightly more gentle program, but again, on day 1, patients should stop glitazones, and specifically stopping SGLT2s, because there's a risk of ketoacidosis with patients stopping if patients continue on their SGLT2. They should also stop a sulfonylurea or a glinide if the HbA1c is less than 70 because of the risk of hypoglycemia. They should continue on metformin. They should continue a DPP-4 or a GLP-1 until the target HbA1c is reached, and stop when that is achieved, i.e. at 3 months. If the blood pressure is over 120/80, so slightly different from the total diet replacement, they should continue all their antihypertensive medication, but in the same way as the total diet replacement, for blood pressure that is well controlled, they should stop medication in specific orders, again with the same caveats around heart failure, previous MI or raised ACR. Again, titration according to protocol at different points in the program for blood pressure and blood glucose. So that's really the key components. There is some further information about what to do if the blood glucose levels are raised, and continuing or restarting medications. If the patient doesn't achieve their target weight loss or HbA1c at the end, obviously worthwhile considering referral on to Tier 3 weight management services such as bariatric surgery program or interconventional structured education. So thank you for watching this.